Carrie, how's it going?
Good, how are you?
Josh,
Nice to meet you.
nice to see you. What brings you in today?
I'm actually here for an outpatient.
Good treatment.
Yes.
How's it going?
So far, so good. It was a little rough for a while, but
Yeah.
the antidepressants and the support group are really helping. So
Support group.
yeah.
How's it going outside of the hospital? How are you coping?
So far, so good. Nothing, no bad incidents so far.
Yeah.
But just spending time with my family,
Nice.
doing other things. So.
Stressed at all?
Not really. You know, work's going okay.
Okay.
So.
You sound like you're managing much better than what you did when you first came in.
Definitely. So.
Good. Good. I wanted to ask you a few questions that we usually do with all patients. There's nothing in particular about you that's causing me to ask these questions. It's just a routine screening procedure that we do.
Sounds good.
We wanted to talk about smoking and tobacco use. Are you a tobacco smoker, cigarette smoker, anything like that?
Yeah, I am.
You are?
Mhm.
Okay. All right. So if possible, I'd like to ask you a few more questions about that, maybe expand on that a little bit. I'm sure you've been beaten over the head by this concept in the past, so I don't mean to do that, but I'd really appreciate if I could ask you a few more questions.
Okay, I guess that's all right.
That's fine with you?
Yes.
Okay. So how frequently do you smoke? Daily thing, is it weekly?
Definitely, about 2 packs a day.
2 packs a day?
Yeah.
And, wow, 2 packs a day, do you smoke the whole pack?
Mm-hmm.
Okay. Sure. Is there any particular reason why you smoke? Is it stress induced? Is it just a habit that you had? Is it?
I think originally it was kind of a stress reliever, and well, I've actually smoked since I was 14, so 10 years, I guess now. I think now it's more of an addiction and just kind of something that's familiar and something I do every day.
So when you smoked when you were around 14, how much did you smoke back then?
Not as much, but it's kind of increased over the years.
Increased since then?
Yeah, definitely.
Okay.
Something I used probably to cope when I was having the depression problems. So.
Mhm. Smoking cessation, stopping smoking, has that been anything that's crossed your mind, or has it been brought up to you in the past?
Definitely brought up, but not something I'm really thinking about right
Yeah.
now at this point.
If you had to say on a scale of 1 to 10, what do you think, like in terms of your motivation to quit, or like where you are at in that process?
Probably lower, maybe a 2 or 3.
Yeah. Do you see smoking as like a positive thing or a negative thing?
I guess both, pros and
Yeah.
cons, so.
What are some of the pros with that?
It definitely is something that's like familiar, so I think that you kind of use it as like a CD type thing.
Yeah.
Also, it definitely like calms me and, you know, kind of makes me nervous not having it, since I also do suffer from depression.
Yeah. It's a good coping mechanism for a lot of different people.
Yeah. So,
Yeah. What about cons? Is there?
you know,
Because obviously you've had this conversation before.
well, obviously, you know, the health benefits, but, I don't know, also family history a little bit.
Mm-hmm.
My father was a smoker.
Mm-hmm.
He died from cancer. So
Your dad died from cancer also.
Mm-hmm.
That's interesting.
Mm-hmm. So definitely.
Even with that, you still continue to smoke.
Mm-hmm.
Is cancer a concern you have?
I guess I try not to think about it, but you know, it's hard not to.
So your method of dealing with it is just sort of pushing it back a little bit.
Yeah.
Well, what do you like most about smoking? Like, why do you cling to it so much?
I don't know. I guess the coping mechanism is probably like the main reason.
Yeah.
So.
If you were to try to quit today, do you think you would be able to sustain it? Like, if you just went, no, probably
If
not.
I was to like completely stop smoking today, I don't think I would be able to stick with it.
Really?
Yeah, I think I just rely too much on it.
Have you tried before?
Yeah, I've tried over the years, you know, a couple of times, but obviously
Yeah.
hasn't been successful.
How many times have you tried?
I don't know, 2 or or 3 maybe.
This can be pretty tough.
Definitely.
Well, it seems like from what you're telling me right now, you definitely have a clear-cut understanding of some of the negative aspects of smoking.
Yeah.
Which I think is a huge plus. Sometimes most people don't even, or they tend to just push that aside and they don't recognize that. I would like to, if you would be open to it, maybe just setting some short-term goals, not necessarily to get you to stop smoking, but maybe just to make that transition a little bit easier for you whenever you're ready for it.
I'm not really sure if I want to do that or not.
Is there any particular reason?
I don't know, I mean, do you think it's really going to be beneficial?
Do you think there would be any positives to?
Just making short-term goals. I don't know, maybe if I heard some examples, I could maybe see the benefit in it.
So people we've seen with depression, definitely, smoking is definitely one way of coping, and especially when you've been doing it since such a young age, it definitely becomes a habit. However, especially with what we read in your chart a little bit earlier, your COPD being a new diagnosis, and then your history of cancer in your family and your dad's death and things like that, there may be other means of coping that maybe we should explore.
Okay.
So,
That's
what are some other ways of stress coping that you've sort of added on top of your smoking in the past few weeks that you've been doing this training?
one thing I guess I definitely enjoy doing is spending time with family, and actually I have a brother who lives here, and he has a daughter who I spend a decent amount of time with, so
Sure.
definitely enjoy doing that.
We mentioned your dad passed. Does your mom still live around here? Does she live in town, or is she out of town?
She's out of town.
Yeah. Okay. Well then, yeah, having some family close by definitely makes it a little bit easier. How does your family feel about your smoking? Do they like it, or?
No, my brother obviously, like, he doesn't smoke and he doesn't let me be around his daughter.
It sounds like you're getting it from all angles in this one.
Yeah,
Yeah.
definitely.
So some of your other coping mechanisms of dealing with smoking, or dealing with the depression, excuse me, is to be around your family. But even being around your family, it sounds like sometimes that can be a little bit difficult because of your smoking habit.
True.
Aside from your family, is there anything else you do? Do you work out? Do you go?
Yeah, I try to exercise. I think it's a good way also of, decreasing the depression. I think sometimes it's just anything to fill the time helps.
Absolutely. Yeah, and it's been shown to definitely lift your mood. Well, it sounds like your family is your second coping mechanism behind your smoking, but the smoking hinders you from getting to that point. Would it sound like maybe a good idea if there would be some way to maybe increase the amount you work out, maybe cut back on the smoking? Would that be something you'd be open to?
Yeah, definitely. I mean, obviously I'm not going to be smoking while I'm working out, so that could be something that helps.
Yeah.
And then obviously I would get to spend more time with my niece also.
What are some benefits that you could see of that happening? Is there anything you think would be good that would come out of that?
From working out more?
From working out more instead of smoking?
Definitely health benefits.
Yeah.
It might be a little difficult because I've been diagnosed with the COPD and been having some shortness of breath lately, but obviously I think smoking might help decrease some of that.
So why don't we try to maybe set a short-term goal? How would you feel about that? Would you be open to it?
Yeah.
So let's set something maybe for the next, I think you're due to come back next week.
Okay.
What if we set a short-term goal next week for next Friday?
All right.
Let's see, you smoke 2 packs a day?
Yeah.
Let's maybe try to cut back. What sounds like a reasonable number to you?
Maybe
I don't know how
closer to
many
1.
cigarettes are in a pack. Maybe 1 pack a day? Do you feel like that'd be something you could do?
I think it would be really hard, but.
Sure. Well, we don't necessarily have to push it that far. Maybe we could just cut back a half pack. And
Okay.
maybe when you get to your second pack and you're down to half of the box, maybe you can just give it to somebody else, or pitch it, or give people cigarettes for free at work, maybe that would make that a little bit easier.
I think that's a little bit more reasonable, maybe.
Yeah. Okay, so it sounds like you're open to it. Well, I tell you what, I'll set up a follow-up appointment because you're supposed to be here again next Friday.
Okay.
So, let's go ahead with that plan if you're okay with that, and let me know how that goes. And
Well.
after we do that, we can sort of adjust and figure out where to go from there.
Sounds good.
Sounds good?
Yes.
Okay.
Thank
See
you
ya.
for your time.
Of course, see ya.
Have a good one.